Welcome to the Health Tech Response to COVID-19 Showcase webinar. I'm Indu Sabaya. I'm the co-founder and president of Catalyst at Health 2.0, where we tackle complex healthcare issues and forge strategic partnerships between innovators and companies interested in new healthcare technology. We do this through many ways, including matchmaking, pilot programs, market research, and innovation challenges. And today we're highlighting a somewhat new mechanism that has been generously supported by the Robert Wood Johnson Foundation, who we would like to thank very much for supporting the work of this community over the past year. A little under a year ago, Catalyst, with the support of RWJF, launched Health Tech Response to COVID-19 to maximize the health tech community's response to the pandemic. The platform features an always-on rapid response open call mechanism, which we'll get to more in a minute, a blog informational site to showcase innovators and experts in this space, which you can see at covid19healthtech.com, and the development of a comprehensive database that allows the public to search and filter for innovative solutions. We call it SourceDB for COVID-19, and you can access that at blue.catalyst.health and see a demo for Catalyst for this on Catalyst's YouTube page. Our co-founder, Matthew Holt, will be joining us and talking more about this a bit later. So the ultimate goal of this platform is to empower healthcare organizations with immediate needs to efficiently leverage digital health solutions during these trying times. With RWJF support, Catalyst has opened up the platform to the larger digital health ecosystem and sought organizations interested in sourcing novel technologies, both COVID-19 specific and those with a broader scope. Today, we will be discussing on local, state, and federal levels what needs two organizations have or had and what solutions they found, as well as we'll hear from three companies with just those solutions. The focus of today's webinar are the Rapid Response Open Calls, or RROCs for short. They are streamlined calls for applications that can be launched within days to support the host's immediate needs. RROCs are launched on the Health Tech Response to COVID-19 website and widely promoted across Catalyst market channels and partners. Submissions are vetted by Catalyst and evaluated by the host based on predefined criteria. Catalyst recommends the top 5 solutions to the host and can coordinate and facilitate virtual demos between the host and the finalists, with the ultimate goal of developing a partnership or pilot between the host and the winner. Our first RROC was with Brigham and Women's Hospital Emergency Department. This open call was for provider-facing text-based solutions to help healthcare professionals, clinicians, receptionists, technicians, and others self-monitor for symptoms of coronavirus, report burnout, and access helpful resources for themselves. We received over 80 applications, and Rose, Smarter Mental Health, was selected as the winner. Our second RROC was with Grapevine Health, helmed by the fantastic Dr. Lisa Fitzpatrick. Dr. Fitzpatrick is a medical doctor who began her public health career in 1998 as a medical epidemiologist at the nation's premier public health agency, the Centers for Disease Control and Prevention, as a member of the CDC's elite epidemic intelligence service. She has also served as a foreign diplomat in the Caribbean while representing the U.S. government CDC Global AIDS program under PEPFAR, and was recently named as a member of the Institute of Medicine National Academy of Sciences Roundtable on Health Literacy, all while founding and running Grapevine Health. Grapevine Health leverages storytelling, community-based support, and digital communication to improve health literacy and healthcare engagement by learning and deeply understanding motivations and factors influencing medical decision-making. Catalyst and Grapevine Health work together on an open call for health tech solutions to share health-focused, customizable video content via text messaging for underserved populations. You will now hear more about this from Dr. Lisa Fitzpatrick herself.
Hi, I'm Dr. Lisa Fitzpatrick. I'm the founder of Grapevine Health. Grapevine Health is a company I started to provide access to credible, trustworthy health information for underserved communities, particularly people on Medicaid. I started Grapevine Health because I noticed the healthcare system largely is unresponsive to some of the personal and social needs of Medicaid and underserved communities. So we wanted to find a way to connect with them digitally, because even though we can serve people in one location, such as where I am in Washington, D.C., there are people just like the people we're serving here in D.C. across the country, and we wanted to scale our services, and the best way we thought to do that was through digital. So that's what motivated us to apply for the RROC opportunity. We wanted to find digital solutions or such as text messaging to help improve or decrease the gap between the healthcare system and the people we were serving. But we knew people had smartphones, and a lot of people aren't aware that underserved communities have access to smartphones. We just aren't using them for healthcare. So we wanted to find solutions to help us bridge that gap and bring digital solutions to underserved populations using the tech they have. But because we're not a tech company, we needed a partner to help us explore these solutions. So we worked with a company, Fin Digital, who successfully applied to the ROC opportunity. And we matched with them, and they turned out to be a great match. Not only do they understand the population we're working with, but they have a long history of experience building digital tools for a variety of companies. This was the first time they actually worked on a project for a Medicaid population, but the relationship worked really well because they were able to point us to different solutions that we could test within our population and identify what worked and what didn't work. And ultimately, what we learned was that the video content was what the community responded to the most. Even though people did use texting based platforms or mechanisms, what we've been looking for is the way to really ramp up or amp up engagement via digital. And it seems that video is the solution. And we couldn't have really learned that without iterating with Fin Digital. So I think our relationship and this opportunity really helped move us to the next level. And we are excited about the future and what can happen next. And we're really grateful to Catalyst for the support we've been given to get us this far.
Thank you, Lisa. We're so happy that we're able to support the work you're doing. It's really important for us to get better communications out there to folks in the Medicaid population. We're so thrilled that we could support it, and with our friends from the Woodward Johnson Foundation. All right, so I'm Matthew Holt. I am Indu's partner in crime, the co-chair at Catalyst.health 2.0. And as you've heard, our first two open calls under the whole health tech response to COVID-19 platform were for problems that they weren't specifically related to COVID itself, but obviously they were made a lot worse during that whole pandemic. So both those rapid response open calls addressed, the needs of local populations. But now we're going to take a step back and look at the sort of bigger problems that COVID made prevalent. First off, at a national level, and then we're going to look at it at a regional level. Okay, so our first speaker in that section, our next speaker, is John Brownstein. John is a big-time star in the world of health IT and innovation. He's a professor at Harvard Medical School. He's best known as the Chief Innovation Officer at Boston Children's. And he directs both the Computational Epidemiology Lab, I just got that right, and the Innovation Digital Health Accelerator at Boston Children's. So, John, you've probably seen him over the last few months, frequent contributor to ABC News. He's created several startups. But most importantly, he's done extensive work with Vaccine Finder, which he created way back when we were around the H1N1 virus, and it's obviously become a screamingly big deal in the last several months as the COVID vaccine rolls out. So he's going to tell you a bit more about that, and afterwards I'm going to take a bit of time to chat with him.
All right, well, thank you. It's great to tell you about our platform, Vaccine Finder, that is now become the sort of the central resource for consumers to figure out where to get vaccines in the community. In fact, while there's a lot of new emerging tech around the pandemic, Vaccine Finder itself has been around since 2009, which was originally created by Google around the H1N1 pandemic as a tool to help people figure out where to get vaccines in the community. This was clearly a problem for that pandemic. And we've been maintaining that platform from Google ever since through support from CDC and HHS. And so when the pandemic emerged, it was clear that there was an opportunity to pivot Vaccine Finder to becoming a central resource in the flow of information as part of COVID vaccine, both as a tool for inventory reporting. And so all COVID vaccine providers actually have to register with Vaccine Finder and provide daily inventory information. And that gives us an insight into supply and, of course, demand, but also making part of that data public as part of a resource for people as they search in their quest for vaccines. And that's through CDC Operation Warp Speed and a collaboration with Castlight. And so the requirements have been for every provider to register with us and essentially become part of the flow of information. Our data flows into the CDC data lake, among other systems like Tiberius, and this gives us full visibility into how supply is being allocated across the country. Vaccine Finder, the public site, launched a few weeks ago with the idea to quickly start providing information to individuals about where to go to get the Moderna, Pfizer, J&J vaccines. This is a very simple tool that gives you information on location, availability of stock, and a quick way for people to quickly jump into confirming eligibility and booking their appointments. And in fact, we've had well over 10 million people already come to the site and get information about vaccines. This is linked directly off of the CDC website currently, which is generating a lot of flow, but then also through a whole range of partnerships that we've launched over the last couple of weeks, including an effort with Google. So our data is directly displayed on Google Maps. It's displayed through a Facebook partnership. It's a partnership with GoodRx, if you know that website, and Apple Maps and Siri. So if you search on Maps or through voice, you'll be able to get Vaccine Finder information as well. Clearly, a lot of our work is also providing deep insights into access to vaccines and identifying important deserts around availability, and clearly trying to figure out those gaps. About 30 million Americans currently live in a vaccine desert with not easy access to vaccines. And so working to figure out how to fill in those gaps through the data that we're collecting. And most importantly, we're in the process of rolling out a sort of a federal site as part of Vaccine Finder in the next several weeks that will be part of the President's Real Initiative to get all American adults vaccinated by the summer. And this site will be an improvement off of the existing Vaccine Finder and will be the sort of vetted central federal website for all people to figure out where to get vaccines in their community. So with that, I'll look forward to chatting more.
John, thanks so much. Really great to see that you build a tool way back when to something else, and yet it comes useful in the future. I mean, who knows, that might happen again. You never know. But you are very close to the pulse of this whole thing, and obviously we see a lot of evidence from DC, and those in the States seeing our evidence, seeing tweets and what have you from our governors. Where are we in the vaccine rollout?
Yeah, I mean, I think that the rollout, I would say overall, you can say is going incredibly well. We've had some bumps in the initial push, but as you see, we're accelerating the pace of getting vaccines into arms. Now, that pace is great on one hand because we're seeing eligibility open up way up across most states way ahead of time. But you do have to ask certain questions about accessibility, where there's equity issues, because as soon as you start opening things up, it does start to favor those people with more resources, more easy access, and the challenges of getting those that are either most vulnerable or maybe more hesitant to make sure that they are in line as well. And so I think that's something we have to keep a close eye on as the rollout keeps expanding to more and more people. But overall, we should be incredibly happy with the pace and and the numbers of people that have been vaccinated, especially in the older age groups. But we got to get to those younger age groups now that we're seeing surges among young adults right now.
Absolutely. So there's sort of two areas that I wanted to ask about. One is sort of the technical challenges of figuring out how to get people lined up for the vaccine around sort of scheduling and access to websites. So we'll talk about that one, and then let's talk about the data. But tell me about the sort of technical challenges and how you think they're being overcome.
Yeah, I mean, the great aspect of where Vaccine Finder fits into the sort of the technology landscape is that it was sort of a mandated tool that all providers had to register with, provide information, and they're required to put daily inventory data. So we've had quite good visibility from the outset when the first vaccines were delivered about where supply was, how it was being administered. I mean, the challenge, of course, is that it's still a voluntary system, and so we're requiring providers to put in daily amounts of vaccine supply. We have the majority of people doing that, but we still have gaps and we still have holes in the data. And, those holes mean it's really challenging when we make that data public to say, with certainty that there's vaccines in the community. So, but as a starting point, as a navigation tool, Vaccine Finder is providing that sort of jumping off point at a national scale. Of course, there are some state level resources that have done really well, many that haven't done so well. So, we're sort of filling in some of those gaps, not trying to supplant some, the tech that's going well, but clearly there was room for improvement. The challenge for us is that we're providing supply information, but we're not putting in so far appointment availability data. And the problem with that is we do not have a national sort of standard, which we're trying to figure out around vaccine appointment availability. And there's a wide range of IT systems across all the pharmacy partners. And that makes it really hard to provide a unified front door for appointment booking. And that's, what we're working on now, but we're not quite there.
So I'm going to dig into that point of it. That was kind of where I was going to get to on the technical issues, right? We know all about where vaccines are now, thanks to your work. There are a number of different systems around scheduling, then messaging people to remind them to come back. And as I always say to people, this is great. We can figure it out this time, but it's going to happen again because next year, we have to get it. So what's your guess, prognostication as to where that kind of national scheduling system integrating all the different components of all the health plan, public health organizations, primary care groups, pharmacies, anybody else who's going to be delivering vaccines, how are they going to work together? Well,
we're converging, and the ONC has been a great partner here. They're converging on a federal standard, and I think that there's an agreed upon sort of FHIR-based view about how to make that data available. Now it's just about getting people on board with that, right? We can make the standard available, but are people going to be fully on board with exposing that kind of data? I think that by the summer, we'll have a handful of at least major organizations, the major pharmacies, a set of healthcare systems that are willing to expose this kind of data. And then, and then hopefully this issue of, when there's, few sort of key groups in there, then everybody will follow, because actually how Vaccine Finder has succeeded over years is that by having a core group of people publicly on the site, you don't want to miss out, because of course, if you're a CVS and you have all your availability data, then you're shifting people to go to CVS's. Well, then Walgreens is going to want to be on the site as well, and then Rite Aid, and then Costco and Walmart. So, it's sort of that network effect. And I think now that we're heading to this new domain of appointment availability, which we've never had, I think that will hopefully have that forcing effect here. But, I don't think that'll be available for like the first wave of sort of full adult immunizations by May. I think we're still a few months off from that.
All right, last question. You've been a pioneer in sort of helping people crowdsource and getting the community around together about sort of citizens creating data.
Yeah.
This has happened very quickly. Obviously, there's been a lot of different attempts and citizens and journalists creating data about the COVID spread itself. Around the vaccines and sort of the surges, do you think there's a role for more citizen data, and how's the community responding?
Oh, absolutely. I mean, there's been many exciting examples. I mean, we're talking to group Vaccinate CA as an example that's crowdsourcing information about appointment availability. I mean, for us, Vaccine Finder has really benefited from crowdsourcing supply issues, because we've always gotten feedback about whether, we show a site, but then they've run out of supply. So there's crowdsourcing the availability, there's crowdsourcing shortages, and we're seeing that happen across pockets of tools around the country, and these community groups that have formed, not only about identifying appointments, but also supporting others to get appointments. I mean, crowdsourcing. I mean, this is an amazing example of crowdsourcing in public health, in addition to the work that happened historically around symptoms and other areas of sort of public health surveillance.
Fantastic. Well, John, thank you so much. Thanks for your leadership on Vaccine Finder and all the other stuff you've done, been doing in this incredible last year. We've seen you on TV plenty. It's great to see the visibility of health data, public health, and technology get together. And you are certainly a great leader in that area. So thanks very much for being with us today.
Thank you.
Thank you again, John, for joining us. As John discussed, while there is headway being made on a national level to consolidate and standardize the data and mechanics behind the vaccine rollout, there are still gaps. Gaps in the data, gaps in equity, and gaps in what capabilities the current technologies have available to support the rollout, including lack of appointment scheduling solutions available for use. Someone else who noticed this gap is our next speaker, Dr. Jacob Ryder. A little bit about Jacob. He is the former Deputy National Coordinator and Chief Medical Officer of the Office of the National Coordinator for Health Information Technology, a staff division of the United States Department of Health and Human Services. He is now the CEO of Alliance for Better Health, an organization that engages medical and social service providers in developing innovative solutions to promote the health of people and communities. Through our RROC platform, Catalyst and AFBH work together to do just what John said, crowdsource solutions for 2 open calls. So I would like to give the stage to Dr. Jacob Ryder.
So I'm here to talk about Alliance for Better Health and the work that we've been doing in the domain of vaccines and pre-registration and how we are addressing the needs of the underserved in these times of vaccination in our communities. So Alliance for Better Health is a small organization based in Albany, New York. We serve 8 counties in the Capital District of New York, which is an urban and rural community, right? So we have some counties are fairly urban, some counties are fairly rural. And the purpose of our organization is to make sure that Medicaid members and the uninsured are as healthy as they possibly can be. As a byproduct of healthy Medicaid members and healthy uninsured community members, they will use acute care facilities, hospitals, emergency departments, et cetera, less frequently, right? Because obviously if you have healthy people, then they don't have to go to the hospital. And if people don't have to go to the hospital, then the cost to the taxpayer is reduced. So if you follow the bouncing ball, our purpose is to keep people healthy so that money is saved. But notice that health is our priority, not saving money. Saving money is the consequence of health, and our focus is therefore on health. Now, in the context of COVID-19 and vaccination, you can't think of a better way to make sure that people stay healthy than to get them vaccinated, right? This is a very obvious thing. People get vaccinated, they don't get COVID, they don't get COVID, they don't go to the hospital. Some of them don't die. So, obviously, if we get people vaccinated, then we will save lives, and of course we will save money. And so it was an obvious place for us to go to insert ourselves into the activity in our communities addressing COVID vaccine. So we looked around and we started to say to ourselves, what are the barriers to COVID vaccination for the people in our community that we serve? And unfortunately, and I think I'll probably throw our government under the bus a little bit here, New York State Department of Health, despite their best intentions, set up vaccine websites in a manner that didn't address the needs of the underserved. Because getting a vaccine appointment, as many have seen in many communities, is similar to getting Red Sox tickets. And in case you didn't know, I'm a Red Sox fan, born and bred in Boston, and it's hard to get Red Sox tickets, even these days. So it's a competition. And those who can hit F5 on their keyboard and those who can open up 7 browser windows get Red Sox tickets, and those who don't can't. And so the underserved members of our community are working. They may or may not have computers. They may or may not have the patience to sit there and refresh the browser. And so some organizations have set up pre-registration. And so this is what we did. We set up a big pre-registration website that just captures your information. You don't have to do it at midnight. You don't have to press F5. You log in, you enter your information, and then instead of giving out vaccine slots reactively, we give out vaccine slots ideally with other parts of our community proactively. And so we reached out to the folks at Catalyst and started to ask questions of the IT community. Hey, how can you help us with this? So there are a couple of phases of the help that we needed because we didn't see any products in the marketplace that really address these needs. The needs are A, pre-registration, B, registration and scheduling, where you have to capture information about who is who and who has a qualifying condition when, because these are sequenced, of course. And then once you get registered, we need to get you scheduled. And how do we set up scheduling? And it's very different from scheduling a doctor's appointment or scheduling a restaurant reservation. And so how do you capture all the right information? And then how do you follow up? If you need to reschedule, is there a texting capability? Is there a way that we can close the loop and see who got vaccinated and who didn't? And if you didn't, can we follow up with you again? And if you did, then we shouldn't bug you again about getting hooked up. And so we've had a great experience working with a number of organizations who made proposals to show us what they had or show us what they could create. And we're very close to making some selections about who wins the competition with the RRCs and can help us meet the needs of the people that we serve so that those people can get vaccinated and ultimately prevent them from getting harmed by COVID-19. So that's about it in 6 minutes or less, and look forward to announcing the winners of this activity, and we're collaborating with the folks at Catalyst and the federal government and the state government to help ensure that the people we serve are as healthy as they can be.
Thanks, Jacob. I really appreciate you joining us on the webinar. Really appreciate all the work that you've done over the years with us and obviously at ONC and Allscripts and now with Alliance for Better Health. It's fantastic to see the progress that's been made, but it's amazing to see, where there are still gaps. Okay. And by the way, we also look forward to hearing about the results of that open call you've been doing. Hurry up and get them to us. All right, so far we've been hearing from people who've basically been looking at the needs and the gaps from big established players, but obviously we want to show you some of the companies who took part in the ROCs, these rapid response open calls, and provided solutions to these problems. So next up, we're going to share with you two companies that took part in the recent open call for the Alliance for Better Health, one for vaccine scheduling and one for vaccine messaging. First up, we have Vana. This is a company way back when used to be called Cupid Me, and CEO Ramin Bastani gave one of the funniest presentations ever at a Health 2.0 conference, talking about his love life. It ended up that they have become one of the major players in communicating HIV status and other STD status with many, many public health departments across the country, which made it a natural segue for them to move into a mobile portal for delivering both test results and now vaccine information. So here is Vana. Take a look.
Vana is an all-in-one results delivery, contact tracing, and reporting platform for COVID-19. We work with any lab to support companies, cities, and states as they scale up their COVID-19 testing. We've already delivered tens of thousands of COVID-19 results directly to patients' mobile phones through our HIPAA-compliant website and apps. Vana also gives patients a mobile record that they can share with doctors, employers, and people they've been in contact with. We provide our customers with advanced reporting tools and heat maps, allowing them to further help patients and identify trends. For more information, email demo@healthvana.com.
Next up is the PathCheck Foundation. This is an MIT spin-off, and Ramesh Raska, who is an old-timer again in the world of health tech, including, he's the guy who did the video of the camera that's going to look around corners and was one of the people behind iNetra, which is an early eye detection technology that we featured way back when. PathCheck is a foundation that was really got going with the pandemic. Huge number of advisors, huge number of collaborators from all over the world. It's really a global nonprofit. It's dedicated to creating healthy and resilient communities. Obviously, it's a big part of what they're doing is figuring out how to help contain the pandemic, but also they've focused a lot on preserving individual privacy at the core of all the work that they do. We got to know them pretty well. They were a finalist at the Johnson Foundation Challenge that we ran for health systems in the pandemic last year. They're also featured in the Facebook challenge we did on innovative data use of that huge data set. So looking forward to seeing, I'm looking forward to showing you how they highlight the work they've been done, particularly around vaccines, vaccine certification and scheduling.
The PathCheck system is an end-to-end privacy-preserving ecosystem, enabling populations to schedule vaccination and screen vaccination eligibility through digital and paper mediums with minimal data intrusion. Users have three options: an augmented CDC card, a smartphone application, and a real-time messaging service. None of these services are standalone operations, and a user can easily shift their user journey from one form to another. Not only do each of these services facilitate anonymous adverse event reporting, but they enable real-time vaccine scheduling as well. PathCheck's decentralized app and vaccine cards set the new standard for interconnectedness. Each of our solutions are easily capable of integrating into existing centralized legacy systems such as vSafe and VAMS without causing friction. The functions are screening, scheduling, administration, and monitoring. To begin a user's vaccination journey, they must enter a valid eligibility number into the app from their paper coupon. Once verified, the user is prompted with health-related screening questions that make sure she doesn't have any adverse health conditions that can trigger health complications after taking a vaccine. The list of screening questions can be modified and updated regularly to make sure all vaccine-related health complications are addressed. After the user passes the screening questions, they can self-schedule a vaccination by choosing available locations and time slots. These time slots and locations are updated regularly to make sure no massive crowds are gathered and that there are enough vaccines to serve everyone. Once the user has received a vaccination, the caregiver prints a QR code with a badge sticker. The user can scan this sticker to gain vaccination information. A new standard for screening and self-scheduling using encrypted coupons, badges, and decentralized protocols.
So as I mentioned previously, both PathCheck and Vana were on the shortlist for the Alliance for Better Health open calls. There are more than 50 applications, and there are many more people coming in, I believe, many more companies coming in who've got solutions for this. But don't forget, the whole vaccine issue is not going to go away. I haven't quite had mine yet, and there are still the majority of Americans and the vast majority of people around the world have yet to receive their vaccines. And of course, it's going to happen every year. So we expect these solutions to spread and do really well. I look forward to hearing great things about both those two and many others. All right. Well, none of this that we do here today would be possible without the very generous support of the Robert Johnson Foundation. Our main friend and proponent there is Kathy Hempstead. Kathy is a senior policy advisor at the Robert Johnson Foundation. She's been there for nearly a decade now, worked with us on multiple challenges and on these rapid response open calls and on supporting our health tech response to COVID-19 and our COVID version of our source database. So With that, I want to thank Kathy and I want to introduce her to say a few words.
I'm Kathy Hempstead, Senior Policy Advisor at the Robert Wood Johnson Foundation, and we've worked with Catalyst for many, many years on a range of different challenges and digital health problems that have related to our programming and other things that are really important to us. And during the time of the pandemic, there has been such a really, really strong demand for rapid creation of different kinds of digital health solutions that can help providers and plans and local and state government in their efforts to reach people with regard to testing, contact tracing, vaccination rollout, especially when people are trying to reach underserved communities and deliver these COVID response efforts in an equitable manner. So I think one of the really exciting things that Catalyst developed in response to this pandemic was this platform that facilitated these rapid response open calls, where instead of having a kind of static challenge where some external party formulated a question and there was a timeline and it was launched at a certain time and people waited for submissions to be due, this was much more geared to the moment, I think, and allowed a more flexible, rapid, spontaneous response, and was really generated by native demands from people that were out there working in the field and needed solutions. So I think that both of the rapid response open calls that you heard about today really were great examples of the way that Catalyst was able to bring the digital health community to respond to this really urgent public health need. And I think that it's been a really nice learning opportunity, because what I really enjoy about this new approach is that everybody is able to learn from the companies that are responding to these demands for help. So that I think that's a great way for other people that might be watching to learn about resources that might help them. I think that people that are putting these requests out are able to learn about, even solutions that they hadn't thought about when they hear about the responses that some of these companies have. And I think that everybody that gets to sort of watch the two sides of this platform learns a lot from the kinds of problems people are having and the kinds of solutions that the digital health community can offer. So I think that, like so many things with COVID, I think that it was fashioned in a response to a crisis, but I think it's something that could prove to have really enduring value and be a good way to address other kinds of health problems that call for a solution from the digital health community. So I've really benefited a lot and enjoyed watching these challenges be described today, and I look forward to seeing similar responses in the future.
Thank you so much, Kathy, and the Robert Wood Johnson Foundation for your support for our health tech response to COVID-19 platform and from Catalyst as a whole over the years. Kathy reiterated an important idea mentioned throughout our program, which is this: there are opportunities now more than ever for startups, entrepreneurs, and citizen scientists to get involved and innovate to better healthcare. And we want to encourage those watching to do just that and get your colleagues to do the same. Here at Catalyst, our goal is to power the health innovation ecosystem. And with this in mind, we are actively working on our next round of challenges and opportunities. So please stay in touch, sign up for our newsletter, follow us on Twitter, and create a profile on SourceDB, which we are planning big things for. And now here to close us out and to show us a little bit about SourceDB, here's my partner in crime at Catalyst at Health 2.0, Matthew Holt.
Thanks, Indu. I look forward to running lots of crime with you in the future. It's been a lot of fun doing it for the last decade and a half or so. All right, just before we go, a quick shout out to the Source database. This is the COVID edition that we mentioned. You can see on the announcement here that if you or your company is working on a response to COVID-19 and you want to feature it here, please just complete a quick form and you'll be included in our repository of health tech responses. This database, you can come, it's free to sign up. You'll see there are sort of 400 or 500 companies in it currently, and you can register on the site here. It's blue.catalyst.health, easy URL to remember. It's a great place to see lots of great solutions and great ideas. So either you can be as a user of these ideas that want to peruse many of these companies that we've had and the challenges and elsewhere, or It could be something that you could come and, as I said, submit your own entry to this. We obviously scan a lot as well, but there are lots and lots of things out there. We'd love to hear from you. So please take a look at blue.catalyst.health. Come sign up. It's free to log in. Doesn't cost you anything. Has lots of great information, and we'd love to hear from you there. With that said, thanks for joining us. Thanks for watching this program. And please, if you have any innovations or you want to hear more about our work at Catalyst, just get in touch with us. Thanks and goodbye.